and it's my pleasure to come to the Congress again. So today I'm going to continue to share our research on the rapid antidepressant effects of Yueju, the clinical evidence, and the novel mechanisms. So basically, we try kind of change the skill from these more practical issue about the high dose of the Western medicine. Instead, I'm introducing Chinese medicine. So in China, many of the patients, if they know there's choice of the traditional medicine, they will not take Western medicine because they scare of those side effects, they scare of the withdrawal effects, and so on. So basically, in this talk, we'll break into 4 parts. I'll tell you a little bit about the background of this relationship between the major depression and the traditional Chinese medicine. And then we'll tell you how we find out the kind of the rapid antidepressant of Yueju in animal models, and then we'll spend more time on the clinical evidence, especially we finished recently, multi-center studies. And then finally, I'll tell you how we interpret why there is this clinical results in terms of the biological mechanism. So we all know that actually depression increasingly become a very serious problem in China. And we all know that the horrible effect is the suicide of this disease. And for the post-COVID-19, there's a phenomena that the significant increase of the adolescent patients, in the hospital. I don't know whether that's also true in Turkey or other countries, but that's really remarkable in China. And in terms of the traditional Chinese medicine, we have a very old internal book. It's called Yellow Emperor's Classics of Internal Medicine. It's emphasized that the emotion have very close relationship with all kind of disease. I'm not going to get the detail about this details, but some idea maybe you can take home, like the yin-yang balance. There's a balance of the mind, body, and kind of formulation stuff. Like not just the one single mechanism over there. It's a kind of holistic story. So actually, there are many. Actually, they come out some kind of theory about the depressions, like the so-called 6 depression theory. It said all this depression come out of those 6 different pathological factors, and and then actually there are more than maybe 100 formulas are using clinically to treat depression, and some of those, like here, this data show that 17 formula has been tested as a monotherapy using in the ST, and show the comparable effects to the Western medicines and the less side effects. But in general, although those traditional Chinese things have extensively used in clinics, the advantage of novel mechanism remain largely underdetermined. So why we study the rapid antidepressant? We all know that there's a disadvantage of those current mainstream antidepressants, SSRIs. You may all know this curve, right? I'm not going to say more about that. And you all know that recently the the finding of the ketamine as a rapid antidepressant really catch attention in the field and still continue catch the attention, get a lot of high impact papers still now, right? Like after 10 years, and they have a different mechanism. But we all know that ketamine is neurotoxic. There's all potential abuse potential and toxic to other bodies. So we have about the same time we think about whether we can find some herb medicine which have been shown clinically effective, but we want to know whether that really can have a faster effect. So we identified the one formula called Yueju pill, which formulated 800 years ago, and we then test this drug in comparison with ketamine using one single dose, and we can see that this formula actually shows similar effects to ketamine. And also, similarly, they increase the hippocampal BDNF, the neurotraffic factors in the brain, just like ketamine. So, and then we test this effect in different animal models, including the most popular ones called chronic models, and also including like postpartum depression models, and also social defeat models. They all works, with a single dose. They can show the effect. And then, as practitioners, you want to know whether what evidence in the clinic. So we first run the first proof of concept study for the urban medicine, and we compare two groups. One group is fluoxetine plus Yueju. The other group is the fluoxetine plus placebo, because we all know that fluoxetine has a very slow action, right? As it's shown here, it really doesn't change much of those symptoms. Well, if we put Yueju together, they can significantly reduce the symptoms, start from 3rd days and continue. And even after we stop using Yueju from the 7 days to to 10 days, 3 days after termination of Yueju, the effect's still there. Well, in the fluoxetine group, there's no effect. So it's not just rapid, and also has a consistent, persistent effect. And later on, we actually run a monotherapy group, and in comparison with escitalopram, and also actually in the patient with more severe symptoms, like around Hamilton score around 35. That's kind of the 9 for the severe major depression. And we can see that these, they still show in this case, we only use the single Yueju, not in combination with any Western medicines. We can see that they still show, the relatively rapid antidepressant effect. The curve is steeper even than the escitalopram. Well, we run the study for 4 weeks in this study, and we found that actually, again, they can increase the BDNF level in the serum, in the Yueju, but not in the escitalopram. So we kind of coined index called neuroplasticity index. It's kind of ratio of the serum BDNF to Hamilton 24 score, which can predict, from the early response to the final response. And more recently, and also we actually also do some imaging study, like MRI study. We can show this prediction like this. There are distinct and shared MRI structure which can predict the treatment response. And in terms of sub-network level predictors, we can show that only Yueju and BDNF can predict this response with visual network. We're kind of excited about these findings because, in terms of the traditional Chinese medicine, visual or eye system belong to the liver system, which is more in charge of the emotion. A kind of, echo of this traditional Chinese medicine theory. So in the more recent, so we have some unpublished findings finished recently. It is the multi-center, double-blinded RTC studies. And this study consists of 8 centers, and we randomized this group of 3 groups. One is Yueju, single treatment. One is paroxetine, single treatment. And one is Yueju combination with paroxetine, and with ratio of 2, 2, and 1. So the combination group has less patients. And it turned out, there's probably similar, ratio come out of the study when we finish it. And this is the Hamilton 24 scores. We can see that about similar level of in terms of the remission rates, and the curve is very similar. And we don't see any, enhanced effect if we combine these 2 drugs together. And also, we also measure the self, report, like a PHQ measurement and the QIDS, SR16, they get similar trends. There's not much difference in terms of those effects. Actually, those doctors, they kind of surprised that, they cannot distinguish, what kind of drugs the patient are taking. And also, we also measure the anxiety using the HAMA system, and basically not much change. But it looks like the combination group actually had better, the trend of the better response. And then we can break down the Hamilton score into different 7 factors. And we can, from this analysis, actually, we can see that the Yueju group have earlier onset of the effect in terms of psychomotor retardation factors. Actually, they start from about 2 weeks. Only Yueju group can improve. And start for the hopeless factors, and also about the same time, only Yueju group can improve. And also, but it's more interesting in terms of some somatic anxiety factor, we can see that as early as 1 week in Yueju, and also in the combination group, there are improvement of this anxiety level, while this paroxetine has no effect. And we can see that not much change for the paroxetine levels. We know that actually, even based on the animal study, they can show actually those at the very beginning, those SSRI actually can increase anxiety, as well as when patients start to withdraw those kind of drugs. And in terms of this monogamy rating score, actually we can see the remission rate even better for the Yueju group. It's more than half of the patients got a remission after 6 weeks of the treatment. In comparison, the Praxis group only got 40%. In terms of the adverse events, we can see that actually these they're much lower, adverse events in the Yueju group. About a quarter of them come in comparison with the Praxis group. And actually, we can see, basically no fatigue symptom. Well, there's a significant, side effect in terms of fatigue, sleep disturbance in the Praxis group. So, how to interpret it? It can be very long story. I don't know whether I have enough time to explain that, but I'll try. So basically, we know that the conventional hypothesis about depression and the antidepressant theory is, the monoamine theory, and especially with the finding of the ketamine rapid antidepressant, the so-called neuroplasticity hypothesis received more attention. And while we want to know what's the exact, is there any new mechanism associated with this herb medicine? And we using the so-called transcriptome study, and we found that there's one specific neuropeptide called PACAP. We found that it's increased after Yueju treatments. So but we know that before our study, this neuropeptide is implicated in mood disorder, especially in anxiety, schizophrenia. But the relationship of this peptide with depression is controversial. Well, before, no people have studied in terms of this hippocampal PCAP related to depression. So we systematically check this effect. We confirm the Yueju can increase both gene and the peptide expression in the hippocampus. And when we inject neuropeptide into the hippocampus, actually they can induce the rapid antidepressant, and which can persist for 7 days, very similar to ketamine and Yueju. And also we use the more cutting-edge technological, so-called optogenetic approach, basically to specifically activate the neurons which specifically express this PACAP. And then when we activate it, this animal will show the antidepressant effect. So this kind of validates this neuropeptide actually is in charge of the antidepressant effects. And also, conversely, if we block the signaling of the PACAP in the hippocampus, the antidepressant effect of Yueju is gone. And also, if we inhibit the neuroactivity in the brain, also the antidepressant effect is gone. Similarly, when we forced knockdown, reduce the expression of this neuropeptide in the brain, the antidepressant effect of Yueju is abolished. And also, one thing catch our attention, if we, even just knock down PACAP, not totally, the animals will show the signs of depression without any, stress protocol. So this implicated that actually the reduced level of the PACAP is associated with the pathology of the depression, and which is, it's confirmed in other, in the different animal models. They all show the reduced expression level of the PCAB. And actually, at the very beginning, we thought maybe this target is unique for this herb medicine, but when we then wonder whether it's applied to other drugs like ketamine or repeated treatment of norepinephrine or fluoxetine. It turned out if we block down this signaling, the effect of ketamine is gone. The delayed antidepressant effect after the repeated treatment of paroxetine or fluoxetine is gone. So that this target probably can be generalized. And then, we know the target, and then we can help try to identify specific molecules in the herb. And we first identified, this herb consists of this formula consists of 5 herbs. We identified the herb or Gardenia jasminos, which is primarily responsible for the antidepressant effect of the Yueju. And we identified the, specific parts, and this compound in these herbs which show the antidepressant effect. But that doesn't mean those specific compound is responsible for the whole formula, because when we use the single compound, you have to use very high dose. Well, and when we have the PCAB in hand, we checked 2 specific compounds with the dose, proportional to the formula. So it's very low dose. When we use those very low dose of these 2 compounds alone, it doesn't have effect. But when we use it together, they have effect. So that is the kind of synergism of the effect. And this both in terms of the stimulation, PCAB, expression, and behaviorally. So basically, that's suggests that we've identified the 2 compounds that's specifically responsible or primarily responsible for this antidepressant effect of Yueju. And also we have identified the specific, the bacteria. So this gut system is one, probably also other system that this herb works. So, I'm not getting into detail about that. Finally, before I wrap up this study, I would like to introduce our we formulate a kind of new formulation, which consists of all of the, the new formulation consists of so-called medicinal and edible multi-herbs. So that they have a better, safety profile because they all consist of edible herbs. And we think that maybe it's better used to prevent major depression and related mood disorder like insomnia and anxiety. So at the very beginning, we want to see the effect on the depression, and it does work, right? When we look at the first 7 days, that by 7 days there's a significant improve. So this come of the 11 patients that can improve. But actually, the better improvement is in terms of anxiety. They can start to show the effect as early as the 3rd days, and also insomnia. And I haven't studied insomnia before, but it kind of surprised me because in those 25 patients, they all insomnia patients, they get, actually can get kind of criteria, clinical criteria, means the clinical criteria of remission after 2 weeks of this, to take over these multi-herb herbs. Actually, we modify, we make these herbs as a jelly, so it's more easily be taken. So the take-home message is that we identify Yueju as a, as a kind of rapid antidepressant effect we got the novel mechanism, and we found the synergism of the two compounds responsible for the effects. And also, we kind of have a psychonutraceutical jelly come out, which may be used to prevent insomnia, anxiety, and depression, especially in youth. With this, I'd like to finish our talk and thank you for the attention.